Therapy. A therapy or medical treatment, often abbreviated TX, or TX, is the attempted remediation of a health problem, usually following a diagnosis. As a rule, each therapy has indications and contraindications. There are many different types of therapy. Not all therapies are effective. Many therapies can produce unwanted adverse effects. Treatment and therapy are generally considered synonyms. However, in the context of mental health, the term therapy may refer specifically to psychotherapy. Semantic field. The words care, therapy, treatment, and intervention overlap in a semantic field, and thus they can be synonymous depending on context. Moving rightward through that order, the connotative level of holism decreases and the level of specificity, to concrete instances, increases. Thus, in healthcare contexts, where its senses are always non-count, the word care tends to imply a broad idea of everything done to protect or improve someone's health, for example, as in the terms preventive care and primary care, which connote ongoing action, although it sometimes implies a narrower idea. For example, in the simplest cases of wound care or post-anesthesia care, a few particular steps are sufficient, and the patient's interaction with that provider is soon finished. In contrast, the word intervention tends to be specific and concrete, and thus the word is often countable. For example, one instance of cardiac catheterization is one intervention performed, and coronary care, non-count, can require a series of interventions, count. At the extreme, the piling on of such countable interventions amounts to interventionism, a flawed model of care lacking holistic circumspection, merely treating discrete problems, in billable increments, rather than maintaining health. Therapy and treatment, in the middle of the semantic field, can connote either the holism of care or the discreteness of intervention, with context conveying the intent in each use. Accordingly, they can be used in both non-count and count senses. For example, therapy for chronic kidney disease can involve several dialysis treatments per week. The words sociology and iametology are obscure and obsolete synonyms referring to the study of therapies. The English word therapy comes by Latin therapia from Greek, theta epsilon rho alpha pi epsilon alpha, and literally means curing or healing. Types of therapies by chronology, priority, or intensity. Levels of care classify health care into categories of chronology, priority, or intensity, as follows. Lines of therapy. Treatment decisions often follow formal or informal algorithmic guidelines. Treatment options can often be ranked or prioritized into lines of therapy: first-line therapy, second-line therapy, third-line therapy, and so on. First-line therapy, sometimes called induction therapy, primary therapy, or front-line therapy, is the first therapy that will be tried. Its priority over other options is usually either 1. Formally recommended on the basis of clinical trial evidence for its best available combination of efficacy, safety, and tolerability, or 2. Chosen based on the clinical experience of the physician. If a first-line therapy either fails to resolve the issue or produces intolerable side effects, additional, second-line therapies may be substituted or added to the treatment regimen, followed by third-line therapies, and so on. An example of a context in which the formalization of treatment algorithms and the ranking of lines of therapy is very extensive is chemotherapy regimens. Because of the great difficulty in successfully treating some forms of cancer, one line after another may be tried. In oncology, the count of therapy lines may reach 10 or even 20. Often multiple therapies may be tried simultaneously, combination therapy or polytherapy. Thus, combination chemotherapy is also called polychemotherapy, whereas chemotherapy with one agent at a time is called single-agent therapy or monotherapy. Adjuvant therapy is therapy given in addition to the primary, main, or initial treatment, but simultaneously, as opposed to second-line therapy. Neoadjuvant therapy is therapy that is begun before the main therapy. Thus, one can consider surgical excision of a tumor as the first-line therapy for a certain type and stage of cancer, even though radiotherapy is used before it. The radiotherapy is neoadjuvant, chronologically first but not primary in the sense of the main event. Premedication is conceptually not far from this, but the words are not interchangeable. Cytotoxic drugs to put a tumor on the ropes before surgery delivers the knockout punch are called neoadjuvant chemotherapy, not premedication, whereas things like anesthetics or prophylactic antibiotics before dental surgery are called premedication. Step therapy or stepladder therapy is a specific type of prioritization by lines of therapy. It is controversial in American healthcare because unlike conventional decision-making about what constitutes first-line, second-line, and third-line therapy, which in the U.S. reflects safety and efficacy first and cost only according to the patient's wishes, step therapy attempts to mix cost containment by someone other than the patient, third-party payers, into the algorithm. Therapy freedom and the negotiation between individual and group rights are involved. By intent. By therapy composition. Treatments can be classified according to the method of treatment. By matter, by energy, by procedure and human interaction, by animal interaction, by meditation, by reading, by creativity, by sleeping and waking, by reading, by create.